All right, everybody, welcome back to the Deep Dive. Today, we are going to be taking a deep dive into the world of cancer.
Ooh.
And specifically, some of the most recent advancements in cancer diagnosis treatment and kind of where the future of cancer treatment and diagnosis is headed based on some current research. I'm excited about this one. This is an area that both of us have done quite a bit of research on.
Yeah, for sure.
But even with all that research, this is a field that's constantly evolving and changing.
Mm-hmm.
So yeah, kind of getting into it, I think it's really important for our listeners to, if they're not immersed in this field,
Yeah.
It could be really overwhelming.
Yeah.
And even for us who, kind of try to keep up on it,
Totally. Yeah.
it can feel like a deluge of information. So
Yeah, definitely.
we've, for this deep dive, we've gone through a couple of different sources. We've got a report on some current trends in cancer.
Yeah.
And then we've also got just a really brief welcome message from Affordable Tutor Education. So that's not going to be a huge focus, but we'll briefly touch on that. But for the most part, it'll be us kind of going back and forth and really talking about some of the most interesting things that we found.
Mm-hmm.
And again, really trying to distill all this down to the most important nuggets because there's a lot going on in this field.
Absolutely. It's a very rapidly changing field, and it really has the potential to impact people's lives in a huge way.
Right.
So I think it's important for everyone to be kind of up to date with what's going on.
Absolutely. So to jump right into it, I think one of the most exciting areas where we're seeing huge advancements is in cancer diagnosis.
Absolutely.
And specifically, I think artificial intelligence is really starting to make a splash in this field.
Mm-hmm.
Yeah,
precision oncology is really coming to the forefront, and AI is kind of the main driver behind it.
Right.
And it's because it can analyze such complex data, and huge amounts of data too.
Right.
It can look at all the clinical text from like doctor's notes and things like that. It can look at genomic data, metabolomic data, radiomic data. It's really incredible what AI can do.
So it's almost like, we talk about AI, sometimes replacing jobs.
Right.
But it seems like this is more of a situation where AI is augmenting what doctors can do rather than replacing them.
Exactly. It's like having this really, really intelligent assistant that can look at all this data that would just be too much for a human to process.
Right.
And identify things that the human eye might miss.
So, what are some specific examples of where we're seeing AI making a real difference in catching these cancers early on?
Yeah, so one example is breast cancer.
Okay.
There are AI algorithms that have been developed that can actually look at mammograms and detect these really subtle anomalies that could indicate cancer.
Wow.
And some studies have shown that these algorithms can be up to 89% accurate.
That's incredible.
Which is just really amazing. And what's even more amazing is that they can potentially detect these signs up to 2 years earlier than traditional methods. 2 years, that's a huge difference. That could really, save someone's life.
Absolutely. That lead time is crucial in cancer treatment.
Right. So what about some of the cancers that are, a little harder to spot early on?
Mm-hmm.
I know lung cancer can be really tricky.
Yeah. So lung cancer is a great example where AI is showing a lot of promise. There are systems that are being developed that can identify malignant lung nodules in CT scans.
Okay.
And the accuracy rates for these systems are around 94%.
Wow.
Which is very impressive.
Yeah.
And they're also really good at reducing false positives.
Okay.
Which is when, something looks like cancer, but it's not.
Right.
And that's really important because false positives can lead to a lot of unnecessary anxiety.
Absolutely. Yeah. And more testing and...
Exactly. Yeah. More invasive procedures, potentially.
Yeah.
And these AI systems have been shown to reduce false positives by about 25% compared to human interpretation alone.
That's fantastic. So it's like really giving the patient, a lot of peace of mind. Yeah, exactly. And reducing the burden on the healthcare system as well.
Right. So it's kind of a win-win across the board, it sounds like.
Yeah.
So we've got breast cancer, lung cancer. Are there other types of cancer where AI is
absolutely
showing promise for diagnosis?
Yeah. Skin cancer is another great example. Deep learning algorithms have been developed that can identify melanoma with about 95% sensitivity.
Wow.
Which is actually comparable to dermatologists.
It's amazing.
Yeah, it's really incredible. And this is really important because melanoma can be very aggressive if it's not caught early.
Right.
So the earlier you can detect it, the better.
Right. And then even for, kind of routine screening procedures like a colonoscopy, it sounds like AI is starting to make a difference there too.
Yeah, definitely. AI-assisted colonoscopy is becoming more and more common,
Oh.
and it's been shown to increase the adenoma detection rate by up to 30%.
Oh.
And adenomas are these precancerous polyps.
Right.
And so if you can find and remove those early, you can prevent colorectal cancer from developing in the first place.
Right. So it sounds like in all these cases, AI is really acting as this incredibly thorough assistant to clinicians,
Exact.
helping them to see things that they might not otherwise catch,
Mm-hmm.
which is really exciting. But I'm curious, are there any challenges, in bringing this kind of technology into everyday medical practice?
Yeah, for sure. I mean, one of the biggest challenges is that these AI algorithms require a lot of data
Right.
to be trained effectively, and it has to be high quality data too.
Right.
And so, collecting and curating all that data can be a big challenge.
Okay.
Another challenge is ensuring that these AI systems are interpretable and transparent.
Okay.
We need to be able to understand how the AI is making its decisions.
Right.
And we also need to make sure that there are no biases built into the algorithms.
Right.
Based on the data that they were trained on.
Right. Because I could see a situation where if the AI is trained on, certain population,
Yes.
You might miss things in other populations.
Exactly. Yeah. So it's really important to make sure that the data sets are diverse and representative.
It's a lot of challenges, but it seems like the potential benefits really outweigh those.
Absolutely.
So we're getting better at finding cancer earlier thanks to these AI-powered tools.
Yeah.
But let's talk about how we're actually treating cancer. And, immunotherapy has really been a hot topic in recent years.
Yeah, for sure. Immunotherapy is a really exciting area of cancer treatment. And it's basically harnessing the power of your own immune system
Okay.
to fight cancer.
So instead of attacking the cancer directly with something like chemo or radiation,
Right.
it's basically giving your body the tools it needs to fight back.
Exactly. Yeah, it's kind of like boosting your immune system so that it
Right.
can recognize and destroy the cancer cells.
And I know we hear a lot about the potential of immunotherapy, but how effective has it actually been?
Yeah, so overall, studies have shown that immunotherapy can lead to significantly longer event-free survival for patients,
Okay.
which means that they live longer without their cancer progressing or recurring.
Okay.
One study showed a hazard ratio of 0.68.
Okay.
And just to explain what that means,
Yeah.
a lower hazard ratio basically means a reduced risk of those events happening.
Okay.
So that's a really good sign.
Yeah, makes sense.
We're also seeing improvements in long-term survival rates.
Okay.
One analysis found that over 86% of patients receiving immunotherapy were still alive after 5 years,
Wow.
compared to about 81% in a group that didn't receive it.
That's a pretty significant difference.
Yeah, it is. And, the response rates for immunotherapy drugs can vary quite a bit,
Okay.
depending on the type of cancer and the specific drug that's being used.
Okay.
But they generally range from around 20% to 70%.
So that's a pretty wide range, but still, even at the lower end, that's still a significant number of people who are benefiting.
Yeah, absolutely.
So can you talk about some specific types of cancer where immunotherapy is really making a big difference?
Yeah, for sure. So one example is non-small cell lung cancer.
Okay.
And there's a drug called pembrolizumab,
Okay.
which has shown a 5-year survival rate of almost 32%,
Wow.
which is a huge improvement over the survival rate with chemotherapy alone, which is about 16%.
Yeah, that's more than double.
Yeah, it is. In patients whose tumors have high levels of a protein called PD-L1,
Okay.
the objective response rate to pembrolizumab is about 45%.
Okay. And so what is that protein and what does that mean?
Yeah, so PD-L1 is basically a protein that's found on some cancer cells,
Okay.
and it helps the cancer cells evade the immune system.
Okay. So it's kind of like a cloaking device.
Yeah,
Yeah.
exactly. So if a tumor has high levels of PD-L1, it's more likely to be resistant to immunotherapy.
Okay.
But there are drugs like pembrolizumab that can target PD-L1
Okay.
and block its effects.
Got it. So it's kind of like taking away that cloaking device.
Exactly.
So what about some other types of cancer where immunotherapy is showing promise?
Yeah. So head and neck cancer is another good example. And a drug called nivolumab has shown an objective response rate of over 13%
Okay.
in patients with recurrent or metastatic head and neck cancer.
Okay.
And, that might not sound like a very high number,
Yeah.
but the median duration of response is almost 10 months,
Wow.
which is really significant.
Yeah.
And it's increased the 2-year survival rate from about 16% to almost 37%.
Wow. That's fantastic.
Yeah. So it's really making a difference for patients who are facing a recurrence.
So it sounds like in a lot of cases, immunotherapy is really providing hope in situations where, previously there weren't a lot of options.
Exactly.
So that's really encouraging.
Yeah.
Are there other types of cancer where we're seeing these kinds of results?
Yeah. Bladder cancer is another one.
Okay.
There's a drug called etsolizumab, which has shown a 23% objective response rate in patients with advanced bladder cancer.
Okay.
And some patients have even achieved complete responses.
Wow.
So that's really promising. In kidney cancer, a combination of nivolumab and ipilimumab, which are both immunotherapy drugs, has shown a 42% objective response rate in advanced cases.
Wow.
And complete remission in 9% of patients.
That's amazing.
Yeah, so it's really encouraging to see these results.
Yeah, it sounds like, immunotherapy is not just one specific treatment, but it's really a whole class of treatments, and we're seeing, really encouraging results across a range of different cancers.
Yeah, it's not a one-size-fits-all approach.
Right.
But there are a lot of different immunotherapy drugs and combinations that are proving to be effective.
So it's kind of about finding the right immunotherapy for the right patient.
Exactly.
Are there other types of cancer that you want to highlight?
Yeah. Blood cancers are also seeing some success with immunotherapy.
Okay.
So, for example, in relapsed or refractory classical Hodgkin lymphoma, pembrolizumab has achieved an 87% response rate.
Wow.
And complete remission in 22% of patients.
That's incredible.
Yeah.
It is.
And then I know there was a case with rectal cancer that was really making headlines recently.
Yeah, that was a really interesting one. So there was a small trial that was done with an immunotherapy drug called dostarlimab.
Okay.
And it focused on patients with a specific type of locally advanced rectal cancer.
Okay.
And these tumors had what are called mismatch repair deficiencies.
Okay.
And the results were incredible.
Really?
The drug resulted in a 100% complete response rate.
Wow.
In every single patient in the trial. The cancer completely disappeared.
That's amazing.
Yeah, it's really remarkable. And it potentially eliminates the need for surgery or radiation in these patients.
Wow.
Now, it is important to know that this was a small trial.
Right.
So more research is needed.
Of course.
But the initial results are really promising.
Yeah, I mean, to think that you could have a treatment that completely eradicates the cancer in every single patient in the trial, it's just incredible.
Yeah, it's really exciting. So, we've talked about AI, we've talked about immunotherapy. Another really big area of focus in cancer treatment these days is personalized medicine. Mm-hmm. So can you talk a little bit about what that means and how it's being used?
Yeah, so personalized medicine is basically about tailoring treatment strategies to each individual patient.
Okay.
Based on their unique characteristics.
Okay.
So, their genetic makeup, the specific molecular profile of their tumor.
Okay.
And even other factors like their lifestyle.
So it's really moving away from that one-size-fits-all approach.
Exactly, yeah. It's about getting the right treatment to the right patient at the right time.
So how is that actually being done? Like, how are doctors actually implementing this in practice?
Yeah, so one of the key tools in personalized medicine is genomic profiling.
Okay.
So this involves analyzing the DNA of a patient's tumor to identify specific genetic mutations that might be driving its growth.
Okay.
And these mutations can sometimes be actionable.
Okay.
Which means that there are targeted therapies available.
But specifically attack those mutated pathways.
So you're basically looking for the specific weakness in that individual's cancer and targeting that.
Exactly. Yeah. It's like finding the Achilles heel of the cancer.
Yeah. Right.
And we can find these actionable mutations in up to 40% of patients with advanced cancers.
Wow, that's a significant number.
Yeah, it is. So, for example, in non-small cell lung cancer, patients whose tumors have EGFR mutations often have response rates of 70 to 80%.
Wow.
When treated with EGFR inhibitor drugs.
And how does that compare to the standard chemotherapy? Yeah,
so the response rate with standard chemotherapy is usually around 20 to 30%.
Wow, so that's more than double in some cases.
Exactly.
So it's really, a huge difference in terms of effectiveness.
Absolutely.
So genomic profiling is one tool. Are there tools that are being used in personalized medicine?
Yeah. Another really exciting development is liquid biopsy technology.
Okay.
So these are non-invasive blood tests that can detect tiny fragments of tumor DNA.
Or even whole cancer cells that are circulating in the bloodstream.
You don't have to do a biopsy of the tumor itself.
Exactly. Yeah, it's much less invasive. And this allows for earlier cancer detection.
Yeah.
You can also monitor how well a treatment is working in real time.
Okay.
And you can even detect when the cancer is developing resistance to a particular therapy.
Wow.
So it's a really powerful tool.
Yeah. It seems like that could really help to, avoid giving people treatments that aren't going to work for them.
Exactly. Yeah, it can reduce unnecessary treatments.
Right.
And in metastatic colorectal cancer, for example,
Okay.
liquid biopsies have been shown to reduce unnecessary treatments by about 25%.
That's great. So we've got genomic profiling, liquid biopsies. Are there other examples of personalized medicine?
Yeah, pharmacogenomic testing is another one.
Okay, and what is that?
Yeah, so pharmacogenomic testing basically analyzes how a patient's genes affect how their body processes and responds to different drugs.
Okay.
So by understanding this, doctors can predict which medications are likely to be most effective,
Right.
and which ones might cause severe side effects.
Right, because we all know, one person might take a drug and it works great.
Yeah.
Another person might take the same drug and have all sorts of side effects.
Exactly. Yeah, everyone metabolizes drugs differently.
Right.
And so pharmacogenomics can help us tailor treatment to the individual patient.
And are there any examples of where this is being used successfully?
Yeah, for example, in breast cancer, pharmacogenomic testing has been shown to reduce severe adverse events by 30%.
Wow.
In patients receiving tamoxifen and aromatase inhibitors.
That's fantastic.
Yeah.
And then I know you mentioned before we started recording that even the bacteria living in our gut
Oh, yeah.
can affect how we respond to cancer treatment.
Yeah, that's right.
So can you talk a little bit about that?
Yeah, so the field of microbiome analysis is really exploding right now.
Okay.
And it's revealing all sorts of fascinating things about how the bacteria that live in our gut can affect our health.
Right.
And it turns out that the composition of a patient's gut microbiome can actually predict how well they'll respond to certain types of immunotherapy.
Wow. So the bacteria in our gut can actually affect how well our immune system responds to cancer treatment.
Exactly. Yeah, it's really amazing.
That's wild.
And in melanoma treatment, for example,
Okay.
patients with certain types of gut bacteria
Yeah.
have shown a 3-fold higher response rate
Wow.
to checkpoint inhibitors,
Okay.
which are a class of immunotherapy drugs.
Wow. So that's incredible.
Yeah, it's really fascinating.
So we're really learning more and more about just how interconnected all these systems in our body are and how they all play a role in fighting cancer.
For sure.
So we've talked about, what's happening right now with cancer diagnosis and treatment. But I'm curious, what are some of the really exciting things that you see on the horizon for the future of cancer care?
Yeah. So one trend that I'm really excited about is the increasing use of neoadjuvant therapies.
Okay. And so what are those exactly?
Yeah. So neoadjuvant therapies are treatments that are given before the main treatment,
Okay.
which is typically surgery.
Okay.
And so the goal is to shrink the tumor
Okay.
before surgery to make the surgery more effective.
Okay.
And ultimately to improve the chances of long-term survival.
So it's kind of like giving the patient a head start.
Exactly. Yeah. It's like softening up the enemy before the main battle.
Got it.
And the evidence is really strong that this approach works.
Okay.
Studies have shown that neoadjuvant therapy can lead to better disease-free survival,
Okay.
which means that patients live longer without the cancer coming back.
Okay.
And it can also significantly improve the rate of successful tumor removal,
Okay.
which surgeons call an R0 resection.
Okay.
And that basically means that they were able to remove all traces of the cancer,
Okay.
even under a microscope.
Okay.
And we're also seeing higher rates of patients who have no detectable cancer in their lymph nodes
Okay.
after receiving neoadjuvant therapy.
So what are some examples of cancers where this approach is being used successfully?
Yeah, so in pancreatic cancer,
Okay.
giving chemotherapy before surgery has been shown to increase the median overall survival to almost 24 months,
Wow.
compared to about 18 months when surgery is done first.
Okay.
And in locally advanced rectal cancer,
Right.
giving chemotherapy and radiation before surgery
Okay.
has significantly reduced the rate of the cancer coming back in the same area within 5 years.
That's fantastic.
Yeah, it is.
And then I know there was a specific study you wanted to mention about neoadjuvant therapy.
Oh, yeah, the Niagara study.
Okay.
So this study is looking at the use of neoadjuvant durvalumab, which is an immunotherapy drug, in patients with muscle-invasive bladder cancer who are scheduled to have their bladder removed. And the results so far are really encouraging.
Really?
Yeah. The study has shown that giving durvalumab before surgery is safe and effective. And it leads to a significantly higher rate of pathological complete response. Which means that no cancer was found in the removed bladder tissue.
Wow.
Compared to the standard approach of chemotherapy before surgery.
That's amazing.
Yeah, it is. And importantly, this benefit was seen without an increase in surgical complications.
So that's great news for patients with bladder cancer.
Yeah, absolutely.
So we've got neoadjuvant therapy. Are there other future directions that you're excited about?
Yeah. Another really exciting area is the development of rapid administration jabs. Including personalized cancer vaccines.
So these are vaccines that are designed to treat cancer.
Exactly, yeah.
Not to prevent it.
Right. So you would get this vaccine after you've already been diagnosed with cancer. And it would help your immune system fight the cancer.
So who's working on these kinds of vaccines?
Yeah, so there are a lot of companies that are working on this. Including some big names like BioNTech and Moderna.
Yeah, I know them for the COVID vaccines.
Yeah, exactly. They're both really active in this field. And there are also some smaller companies like Myenneo Therapeutics that are doing some really innovative work. And there are currently over 45 active clinical trials underway in this field.
Wow.
Yeah, so there's a lot of research going on, and we're starting to see some really promising results.
So what are some examples of these vaccines and how they're working?
Yeah, so BioNTech's BNT122 mRNA vaccine, when given in combination with the immunotherapy drug pembrolizumab, has shown a 50% reduction in the risk of the cancer recurring in patients with stage 3 for melanoma.
That's incredible.
Yeah, it is. And that was in phase 2 trials, so it's still early days. But the results are very encouraging. And it seems like the FDA is also really interested in accelerating the development of these new treatments. Yeah. They've recently granted fast track designations to several key drugs targeting cancers of the liver, colon, and ovary. And this is basically a process that's designed to speed up the development and review of drugs that show the potential to address unmet medical needs.
So it's kind of like putting them on the fast track for approval.
Yeah.
So are there any specific drugs that have received this designation that you want to mention?
Yeah. One drug that received this designation is BMKR-101. Which has shown a 37% disease control rate. In patients with advanced hepatocellular carcinoma who had not responded to any prior systemic therapies.
So that's a really tough group of patients to treat.
Yeah, it is.
And so to see those kinds of results is really encouraging.
Absolutely.
So it sounds like, the research on these personalized vaccines is really focused on two main things. One is developing the vaccines themselves. And then the other is really understanding how they're working within the body.
Exactly. Yeah, we need to understand the mechanisms behind these vaccines so that we can optimize them and make them even more effective.
So what are some of the things that researchers are looking at in terms of how these vaccines are working?
Yeah, so there are a lot of clinical trials underway that are examining the immune responses that are generated by these personalized vaccines. So, for example, they're looking at what types of immune cells are activated, how long those immune responses last, and whether the vaccines are able to generate memory immune responses, which would protect against the cancer coming back in the future. And they're also looking at using these vaccines in earlier stages of cancer. And they're also developing vaccines that are designed to specifically stimulate certain types of immune cells, like CD8 plus T cells, which are really good at killing cancer cells. And some of these vaccines are even being designed to target up to 20 different patient-specific neoantigens, which are unique markers on the cancer cells.
So you're really honing in on that specific patient's cancer.
Exactly. Yeah, it's all about precision.
So to kind of bring it all together, it really sounds like 2025 is shaping up to be a year of huge transformation in how we approach cancer.
Absolutely.
We've talked about so many exciting advancements. AI-driven diagnostics, immunotherapy, personalized medicine, neoadjuvant therapy, these rapid administration vaccines.
It's really a convergence of all these different fields.
Yeah, and it's all happening at the same time.
Yeah.
So it's just incredibly exciting.
It's a really hopeful time for cancer research.
Yeah, and I think for patients and their families, to see all this progress happen.
Yeah, it gives people a lot of hope.
It really does give you a lot of hope.
Yeah.
The fact that we're finding cancers earlier, we're seeing better response rates to treatment. We're reducing the burden of side effects through personalized medicine. I mean, it's all just really encouraging.
Yeah, it's a really exciting time to be in this field.
Yeah, and I think it makes you wonder, what does all this mean for the future of cancer care? Could we be on the verge of fundamentally redefining our relationship with this disease?
That's a really interesting question.
What if cancer in the future is not the death sentence that it is for so many people today?
Yeah. I mean, that's the ultimate goal, right? To
Yeah.
make cancer a chronic disease that people can live with.
Right.
And I think we're getting closer and closer to that goal.
Yeah, it's definitely something to think about. Well, this has been a fantastic conversation.
Yeah, I've really enjoyed it.
Me too. I've learned a lot, and I'm sure our listeners have too. So thank you for diving deep with us today.
My pleasure.
And we'll see you next time on The Deep Dive.